Hello there, young doctors. Welcome back to Asan Network. I am your Dr.Salauddin, MBBS MS Orthopaedics, and we are continuing with our fracture classification series. The next bone in our fracture classification series is the forearm bones, that is the radius and the ulna. We will first see the different parts of the radius and ulna, then we will go into individual classification. So first, proximal end of the ulna, this is the proximal 1/3, this is the middle 1/3, and this is the distal 1/3. In the proximal 1/3, you have the olecranon. So we'll have the olecranon fractures, then we have the coronoid process fractures, then radial head fractures, then middle 1/3, we have the shaft fractures. So in the shaft fractures, there is one particular type called as Monteggia fracture dislocation. In the distal third, we have the distal shaft fracture along with ulnar dislocation, that is called as Galeazzi fracture. Finally, we have the distal radius fractures. So distal radius fractures will divide accordingly. So overall, olecranon fracture, the coronoid process fractures, the radial head fractures, then the proximal 1/3, we have the Monteggia fracture, middle and distal shaft fractures, then the Galeazzi fracture and the distal radius fracture. First is radial head fracture. So what is the classification for radial head fractures? It is Mason classification. So Mason gave the classification for radial head fractures. Before diving into the radial head fractures, we will see little bit about the anatomy. So where does the radial head articulating with? This is the distal humerus, this is the radial head, and this is the olecranon of the ulna. So radial head is articulating with our, yes, you are right, that is capitulum. So radial head forms the radiocapitular joint. So how does the radial head get fractured? So it has to get impacted with the capitulum in the axial loading or axial compression. One is axial compression, it has to get fractured. Other is lateral compression of radial head on the capitulum. These are the two mechanisms where the radial head can get fractured. So according to this, we'll classify the radial head fractures. So the radial head first type, the first type is there is a fracture but it is undisplaced. So first is undisplaced fracture. Next, the fracture is getting displaced, there is a fracture gap, there is displacement. Third is comminuted fracture. There is one more type that is not from the Mason, but it is a modification in the Mason classification which was given by Hotchkiss. It is the type 4 where there is radial head fracture along with elbow dislocation. If radial head is fractured and the elbow is getting dislocated, it can be any type of radial fracture. 1, 2, 3. Any type of the radial head fracture along with elbow dislocation is called as type 4, which is an Hotchkiss modification in the Mason classification. So type 1 is non-displaced. Type 2 is displaced marginal fractures, which is due to impaction, compression or depression, then angulation. Then comminuted fractures, then Hotchkiss modification of radial head fracture with elbow dislocation is the type 4. So this is an example of the radial head fractures. In the X-ray, can anyone tell me where is the radial head fracture? Yeah, it's pointed in the arrow. Here is the radial head fracture. Now you tell me what type this is according to Mason classification. In this also, here is the, in this X-ray also, here is the radial head fracture. What type it is? This is undisplaced. The fracture is undisplaced, that is why it is type 1 of Mason. Here also it is undisplaced. Here also it is the type 1. Then come the final X-ray. Here you can see there is slight displacement of the fracture fragment. This is type 2 of the Mason classification of radial head fracture. Next, we'll cover the olecranon fractures. Olecranon fractures, there are two types of classifications. One is Mayo's classification, other is Schatzker's classification. According to Mayo's, you simply divide the olecranon whether it is comminuted or not comminuted. So this is the olecranon, this is the coronoid process, this is the distal humerus. So if there is only one fracture fragment, one fracture line, it is not comminuted. If it has multiple fracture lines, it is comminuted. Based on this, he divides whether it is undisplaced or displaced. It's a simple classification of the olecranon. See, one is there is undisplaced fracture and whether it is simple or comminuted. First one is undisplaced, simple, comminuted. Next is displaced, whether it is uncomminuted or non-comminuted. Next is unstable fracture, not comminuted or comminuted fracture. Type 2 and 3 are same, only difference is type 2 is stable fracture, there is no chance of dislocation. Type 3 is unstable where there are more chances of dislocation of the elbow. This is the Mayo classification for olecranon fracture. Next is the Schatzker's classification. Here based on the fracture pattern, he simply divides them into transverse fracture, transverse impacted fracture, then the oblique fracture, then comminuted fracture, then oblique distal fracture, then the fracture dislocation. Total 6 types in short skirts based on the fracture pattern line. Okay, this is the simple short skirts classification. Now we will see examples with X-rays. What type is it according to Mayo and short skirts? Is it comminuted or non-comminuted? It is non-comminuted. Only one fracture line is there. Is it displaced or undisplaced? It is displaced. Non-comminuted displaced fracture. Whether the elbow is stable or unstable. Here the elbow is stable. So non-comminuted displaced stable fracture is type 2 of Mayo. This is type 2 Mayo. What type is it according to Shashkas? Is it transverse oblique or oblique stable or unstable? This is simple transverse fracture. Transverse fracture of olecranon according to Shashkas. This is another X-ray. Now you tell me what type is according to Mayo. Tell me whether it is comminuted or non-comminuted. You can easily see there are multiple number of fracture fragments. So this is a comminuted fracture. Now whether it is undisplaced or displaced, easily you can see there is a lot of gap. This is displaced fracture. Now you tell me whether it is stable or unstable. No, this is unstable. The elbow has been dislocated. This is unstable fracture. So comminuted displaced unstable fracture is type 3 of Mayo. According to Schatzker, it is comminuted fracture. Okay. Next, we will go to the coronoid process. So coronoid process, the fracture classification name is Regan and Murray. So coronoid has an R and it starts with an R. The classification for the coronoid fracture starts with an R, that is Regan, and Murray also has R. Coronoid, Regan and Murray classification. So where is the coronoid process? This is the olecranon, this is the distal humerus, this part is the coronoid process. So that coronoid process fracture can be simply divided based on the amount of the fracture. Simple tip, if it is fractured, it is an avulsion. If it is more than or less than 50% or complete fracture of the coronoid process. This is an simple Murray, Regan and Murray classification. See, type 1 and 2, 1, 2, 3 and 1, 2 and 3 based on the size of the fragment. The coronoid fracture, it is based on the size of the fragment. Type 1 is simple avulsion of the tip. Then type 2 is the single or comminuted involving 50% of the coronoid process. It is less than 50%, 50% or less than 50% of the coronoid process. It is type 2. If it is more than 50%, it is type 3. This is simple Regan and Murray coronoid fracture. Now you tell me, where is the fracture line? The fracture line is here. Here is the fracture line. Now you tell me it is 50%, less than 50% or more than 50%. Divide it into complete 3 parts. See, it is this is the 50% line. It is almost more than 50%. So it is more than 50% of the coronoid fracture. So it is type 3 of Regan and Murray classification for coronoid process. What is the importance if it is less than 50% or more than 50%? So if it is less than 50%, the elbow will be stable. There is no displacement of the ulna posteriorly. Okay, if it is less than 50%, the coronoid process will be still intact and it will stop the ulna from dislocating posteriorly. If it is more than 50%, it is inherently unstable and there is more chances of dislocation of the elbow. Okay. Here is the another example. You can see almost whole of the coronoid process has been fractured out. Okay, this is more than 50% of the coronoid process has been fractured. Here also the more than 50% of the coronoid process has been fractured, and as you can see the distal humerus is not present in the olecranon, that is it is dislocated. So if more than 50% of the coronoid process is involved, the elbow gets dislocated. This is type 3. Next is our Monteggia fracture dislocation. You get the you get easily confused between Monteggia and Colles. Remember, Monday comes first. Okay, Monday comes first in the week. So in the elbow from shoulder to the tip of the hand, the elbow comes first. So near the elbow, the proximal part, it is Monteggia fracture. So what bone is getting fractured and what bone is getting dislocated? We are discussing the proximal 1/3 ulna shaft fracture. So proximal 1/3 ulna is fractured and the radial head is dislocated. The radial head is dislocated. This is called as Monteggia fracture dislocation. So who gave the classification? Bado. बड़ा आदमी मंडे, that is the starting point. मंडे आके बड़ा आदमी क्लासिफाई करा. Monteggia fracture dislocation has given by the Bado. So Bado, he classified the Monteggia classification into 4 types, simple 4 types. Based on what he has classified, what is the basis for this classification? There is a fracture and there is a dislocation. Okay, only he depended on the displacement of the fracture and the radial head, on what side it is displacing, whether it is going anterior, medial, lateral or posterior. Based on this he has given the classification. So बड़े भाई देख लो, anterior dislocation है. So the fracture is angulated anteriorly and the radial head has gone anteriorly. So anterior dislocation is type 1. Next is posterior dislocation. The angulation of the fracture is posterior and the radial head has gone posterior. So it is type 2. So type 2, there is posterior dislocation of the radial head and angulation of the fracture is posterior. So type 1, the radial head is anterior and ulnar angulation is anterior. In what mechanism does it occur? It is forced pronation. So anterior आना है तो pronation. Forced pronation will cause anterior angulation and anterior displacement of the radial head. Similarly, posterior dislocation or posterior angulation of the ulna is caused by axial loading in an flexed elbow. When the elbow is flexed and there is an axial loading, then it will cause radial head to go posteriorly and angulation getting posterior. Okay, this is the type 1 and 2. Now we will come to type 3 and 4. 3 is when there is lateral displacement of the radial head. The radial head is gone laterally and the fracture is angulated laterally. This is type 3. Type 4 is when you have proximal 1/3 radius shaft fracture and ulna fracture. This is type 4. When both the radius shaft and the ulna shaft proximal 1/3 are fractured, it is called as type 4. यह है type 4 बड़ो classification. So radial head lateral ulna metaphysis fracture, it is because of forced abduction of the elbow. So you give an forced abduction, then you have an lateral displacement of the radial head and angulation of the ulnar shaft laterally. If you have to, the fourth one is radial head anterior and radius shaft fracture. It is high energy pronation. Type 1 and type 4 are same. Only difference is type 4 has radius shaft fracture. Type 1 doesn't have. Okay. This is the Bado classification for Monteggia fracture. Now you tell me what type of Monteggia this is. Yeah, come on. You know, just we have discussed the angulation of the fracture. The ulnar fracture, it is anterior and the radial head is dislocated anteriorly. So anteriorly, is there any shaft fracture of radius? There is no. So without any shaft fracture, only angulation of the radial ulnar fracture and radial head dislocating anteriorly, it is type 1 of Bado classification. Okay, this is type 1 of Bado. What is this? Here the angulation of the ulna is posterior. The angulation of the ulna is posterior and the radial head is also gone posterior. So when ulna metaphysis is gone posterior and the radial head gone posterior, it is type 2 of Bados. Okay. Now this is, yeah, you are right, the fracture is gone lateral angulation and the radial head has gone lateral displacement. This is type 3 of Bados. Next we have the Jupiter classification of type 2 Monteggia. What is type 2? Type 2 is posterior dislocation of radial head and posterior angulation of the ulnar fracture. So what are the types in this? So Jupiter has subclassified type 2 Monteggia into 4 types. First one is when the fracture of the ulna is at the coronoid level. When it is at the coronoid level, it is type 2A. 2A is coronoid level. Then type 2B is when the fracture is at the metaphysio-diaphyseal junction, it is type 2B. When it is distal to the coronoid, this is the coronoid and it is distal to the coronoid, then it is type 2C. When the fracture is extending distal half of the ulna, the fracture is extending the distal half of the ulna, it is type 2D. This is the subcategories of type 2 Monteggia which is given by Jupiter. Okay. Now coming to AO classification of radius and ulna. Can anyone tell me what is the number for radius and ulna? What is the number for humerus? In the previous videos we have told you what is the number for humerus. Humerus is 1. That is the first bone in the body that has given the number 1. Similarly, the forearm bones are given the number 2. Okay. Accordingly, radius is given the number 2R and ulna is given the number 2U. See, radius is 2R and ulna is 2U. Again, for the proximal, middle and the distal, you again subdivide it into 2R1, 2R2, 2R3, 2U1, 2U2 and 2U3. Proximal, middle and distal. This is the alphanumerical AO classification for radius and ulna. So R1, 2R1, that is radius bone, proximal end. So proximal end again is divided into A, B, C. So A is in every bone, whether it is near the joint, you divide it into extra-articular, partial articular and complete articular fracture. So when it is an extra-articular fracture, type 2 R1A, A1 is when you have avulsion of bicipital tuberosity. So this is the bicipital tuberosity. When it is avulsed, it is called as A1. Then you have the neck fracture. Simple neck fracture is A2 and comminuted neck fracture is A3. This is extra-articular fracture of the proximal 1/3 of radius. Then partial articular is simple avulsion fracture, then fragmentary avulsion fracture B1 and B3. Complete articular is simple complete articular fracture and fragmentary or multifragmentary complete articular fracture C1 and C3. This is the proximal end R1, A, B and C. Then comes the diaphyseal, that is R2. R2 is diaphyseal. ABC diaphyseal, you have simple, wedge and multifragmentary. So simple is again A1 is spiral, A2 is oblique and A3 is transverse. Oblique, when do you call oblique? When the fracture line is more than 30 degrees. If it is less than 30 degrees, it is transverse. More than 30 degrees is oblique. Wedge is when you have an intact wedge or multifragmentary wedge B2 and B3. Multifragmentary diaphyseal fracture is intact segmental fracture, comminuted segmental fracture. Okay, as it is as simple as such. Next comes the distal end of the radius. Distal end, again it is an articular segment. So extra articular, partial articular and complete articular. So extra articular, one is first A1 is styloid process, A2 is simple extra articular distal radius fracture, then A3 is wedged or multifragmentary extra articular fracture. Then we have the partial articular fractures where the fracture is in the sagittal plane is the B1, then volar Barton's, that is the dorsal rim of the distal radius is fractured, that is the dorsal Barton fracture, that is B2. Then volar is the B3. Dorsal side fracture is the B2 and volar Barton is the B3. Next comes the complete articular fracture where you have a simple complete articular fracture, that is C1. Then C2 is the multifragmentary fracture. Then multifragmentary metaphyseal fracture is the C3. Okay, this is the radius AO classification. Coming to ulna is again proximal, distal, mid and distal. U1 is proximal end. So U1 proximal ABC, proximal end again articular, extra articular, partial and complete articular. So extra articular avulsion of the olecranon where the triceps is attached, similar to radius where the bicipital groove, biceps is attached, it has avulsed, so it is A1. Here A1 in ulna is triceps is avulsing the olecranon. Next comes the simple metaphyseal and then multifragmentary metaphyseal. This is simple metaphyseal is A2, multifragmentary metaphyseal is A3. Coming to partial articular, when the olecranon in the articular part is fractured, it is B1. When the coronoid is fractured in the articular part, it is B2. Then finally the olecranon and coronoid both are fractured, it is C3. We have only C3 in the complete articular proximal end of the ulna. Coming to diaphysis of the ulna, again simple, wedge and multifragmentary. Simple is again you divide it into spiral A1 less than 30 degrees, it is transverse A3 and more than 30 degrees it is oblique A2 fracture. Wedge, in wedge type you have an intact wedge or an multifragmentary wedge. In the multifragmentary type you have an intact segmental or an multifragmentary segmental. This is ulna diaphyseal. Coming to distal end of the ulna, it is an articular end, but it does not involve much in the articular process, articulation of the wrist joint. Maximum of the wrist joint is formed by the distal radius. So distal radius maximum it covers the wrist joint. Distal ulna has less part in the wrist joint formation. Okay, so it has only extra articular, partial and complete articular fracture. The extra articular is simple styloid process fracture, simple extra articular fracture and multifragmentary fracture A1, A2 and A3. Then the partial articular and the complete articular fracture of the distal end of the ulna. Next, we will going to discuss the most important topic of the topic today, that is distal radius fracture. The first classification in the distal radius fracture is the eponym classification. We will see what are the names in the distal radius fracture. See, the first one is Colles fracture, second Smith, third is Barton's fracture, 4 is Chauffer's fracture, and 5 is Melone's fracture. सर ठीक है, अच्छा है, आपने 5 नाम बता दिया. Now how do I remember this? Simple, keep any mnemonic that you like. I use the mnemonic CBSCM. CBSCM. CBS is Colles, Barton and Smith. CM is Chauffeur's and Melone fracture. Okay. Colles is, in these 2 fractures are extra-articular and remaining all are intra-articular fractures. So Colles, the displacement of the fracture is dorsal side. In the Smith, the displacement of the fracture is volar side. What is the mechanism for Colles? It is fall on outstretched hand on wrist extension. If you keep it flexed, then the fracture will go volar side. It is Smith fracture. Wrist extension, fall on outstretched hand, it is Colles fracture. You can see wrist extension, fall on outstretched hand, the fracture fragment of the distal radius goes dorsally, it is Colles fracture. When you flex the wrist, fall on outstretched hand, then the distal radius will go into volar side. It is Smith fracture. Then coming to Barton. Barton is an intra-articular fracture. It can be either dorsal Barton or a volar Barton based on the displacement. It is an shear injury. In B2, the fracture pattern is oblique. So, it is an oblique fracture in the intra-articular part. So, the fragment, it can slide through the fracture site. Okay, this is called as shearing force. When there is an axial loading, the fracture fragment can slide through the fracture site. So, if it slides towards the dorsal side, it is dorsal Barton. If it slides towards the volar side, it is an volar Barton. So, then the Chauffeur's is also called as Hutchinson fracture. It is also an intra-articular fracture, but it's a radial styloid fracture. When the radial styloid in the intra-articular part is fractured, it is called as Chauffeur's fracture. It is due to direct compression or direct blow over the radial styloid. Then we have the 4-part intra-articular fracture, that is the Melone classification, where the distal radius is multifragmentary and the fragments are displaced in multiple directions, and also you have the distal radio-ulnar joint dislocation or disruption. It is a very high energy trauma and you have an rotational force involved. So, multifragmentary intra-articular fracture with DRUJ disruption is the Melone fracture or Melone 4-part fracture. Coming to each type. So, first one is Colles, when it is an extra-articular fracture at the metaphyseal-diaphyseal junction and the fracture fragment is displaced. Where it is displaced? It is displaced dorsally. When it is displaced dorsally, it is Colles fracture. If it is displaced volarly, it is Smith fracture. The fracture is displaced volarly. Then Chauffeur's is an intra-articular fracture with radial styloid fracture. The radial styloid is getting fractured. It is Chauffeur's. Other name for Chauffeur's is Hutchinson fracture. Then Barton's, whether it is an volar or dorsal, here the fracture is going volarly. So, because of the shearing force, here is the axial loading. Because of the axial loading, the fracture fragment goes into a shearing force and it is displaced volarly. So, it is an volar Barton. Okay. So, if similarly if the fracture is here, if the fracture is in this pattern, the fracture fragment will go dorsally, then it becomes the dorsal Barton fracture. Okay. This is also an intra-articular fracture. Finally, the Melone classification. where Melone has 4 parts. That is, first is the dorsal lunate fossa. The dorsal side, this is the lunate fossa. This is the first part. Second is the central lunate fossa. Third is the volar lunate fossa. The lunate fossa of the distal radius is divided into dorsal, central and volar. Then the fourth part is the radial styloid, and one more part, that is the radial shaft. This is the fifth part, radial shaft. So these are the 4 parts that are displaced in multiple directions. The dorsal fragment goes dorsally, volar fragment goes volarly, radial styloid goes more laterally. These are all the multiple displacement, that is an high energy trauma, that is Melone 4 part. Then coming to the Colles fracture, the classification given is by Frykman. So it has total of 8 types. Basically 4 types. Only thing, the difference is whether it has an ulna fracture or not. If it has an ulna fracture, then you add one more type to the existing type. Extra-articular fracture. Without any ulna fracture, it is type 1. If it is having an ulna fracture, it is type 2. If the Colles fracture is involving the intra-articular area at the radiocarpal joint, one fracture line going to the radiocarpal joint, it is type 3 without ulna. With ulna, type 4. Then intra-articular fracture involving the DRUJ. I will show you the images, you will understand better. It is type 5, with ulna is type 6. Intra-articular fracture with radiocarpal and DRUJ both, it is type 7. Without ulna, with ulna is type 8. I will show you the images, then you will understand better. So Frykman, first, it's a simple extra-articular fracture. There is no ulna fracture. It is type 1. Here the ulna is also having involved. Along with type 1, it is type 2. Then intra-articular fracture line. It's an extra-articular fracture with an intra-articular fracture line going to the radiocarpal joint. The fracture line is going to the radiocarpal joint. It is type 3 without ulna. With ulna is type 4. Then the extra-articular fracture is involving the distal radioulnar joint. Here you can see the distal radioulnar joint is involving from the fracture line. It is type 5. With ulna, it is type 6. The intra-articular fracture with radiocarpal, the radiocarpal and the DRUJ both is type 7. With ulna it is type 8. This is Frykman classification. Now we will see examples with the X-rays. So now you tell me what type of fracture it is and what is the name for this fracture. Where is the fracture line? See, here is the fracture line. Now where is the displacement? This is the dorsal side, this is the volar side. So now which side is the displacement? The fracture fragment has gone dorsally. So if the extra-articular fracture gone dorsally, it is called as Colles fracture. Now you tell me what is this fracture. First you tell me whether it is an intra-articular or extra-articular. This is an extra-articular fracture. In AP view you can see here is the fracture line. This is the distal fracture fragment. Here is also the distal fracture fragment. Now you tell me where is the displacement. This is the dorsal side, this is the volar side. Yes, the fracture has gone volarly. So when the fracture has gone, extra-articular fracture gone volarly, it is called as Smith fracture. Now you tell me what is this fracture. Where is the fracture line going? This is an extra-articular fracture along with one fracture line going in the radiocarpal joint. Can I name it as intra-articular fracture like an Barton or an Chauffer's? No. This is also an Colles fracture. As we have discussed in the Frykman classification, he gives where there is an extra-articular Colles fracture along with one fracture line going to the radiocarpal joint. It is type 3 where the ulna is not involved. If the ulna has been involved, it would have been type 4. So this is an type 3 of Frykman's Colles fracture. What type is this? Is it an extra-articular or an intra-articular? In AP view, it looks like an extra-articular fracture. But when you see the lateral view, there is an intra-articular fracture fragment. It's only the half of the fracture fragment which has gone dorsally. Okay, this is the dorsal Barton fracture. Now what type of fracture is this? Only one fracture line. This is the radial styloid fracture, which is called as Chauffer's or Hutchinson fracture. Now you tell me what type is this? Is an intra-articular or extra-articular? There are multiple fracture fragments, multi-fragmentary. Only one view is not enough. We have to get an CT scan to see how many fragments are there. This is a type of Melone 4-part comminuted fracture. This is a distal radius Melone 4-part comminuted fracture where there are multiple fracture fragments in the distal radius. Okay. Now another classification of distal radius is Fernandez classification. So Fernandez classification of distal radius is based on only one thing, that is mechanism. What mechanism is causing the distal radius fracture? Based on the mechanism, the Fernandez, he classifies the different types of distal radius fractures into 5 types. First is bending, next is shearing, then compression, avulsion and combined forces. So if there is only bending, if you only bend the distal radius, what type of fractures can you expect? Extra articular fractures like Colles and Smith is because of bending fracture. So there is loss of palmar tilt, there may be radial shortening and there may be associated DRUJ injury. Okay, this is because of bending. Then shearing force, the distal end, the distal radius, one fragment is going because of loading. Because of the loading, there is shearing forces. What type can you expect now? There you can expect Barton fracture. Okay, Barton's fracture is because of shearing forces. It requires reduction and buttressing of the articular segment. In the management part, you have to reduce the Barton's fracture. Okay. Then compression, only the axial loading. What type of fracture can you expect because of compression? Only extra articular fractures we can expect like Colles and Smith. Typically there may be without any fragmentation and there is high risk of intraosseous ligamentous injury. Okay, in compression type of forces. Avulsion, you can see radial styloid fracture or sometimes there may be radiocarpal fracture dislocation. Then combined forces, we can see Melone type of fracture. Okay, it is soft tissue involvement and high energy trauma. You can see in the images. See, the first one is bending. If you bend, it is extra articular fracture like Colles. Next is shearing. When there is an axial load with a fracture in the shearing pattern, you have an Barton's fracture. Okay. Next is compression, where you can see. Then is the avulsion fracture, where you can see the radial styloid avulsion fracture. Okay. Then you can see combined forces, where there is Melone type of comminuted fracture. There are multiple fracture fragments. We will see the example. Now you tell me what type of fracture it is and what mechanism it involved. Extra articular. It is displacing dorsally. So dorsal extra articular fracture is Colles. Now what mechanism is causing this? This is because of bending force. So bending force causes Colles fracture. Can you specify the mechanism? That is FOSH, fall on outstretched hand, with, whether it is extension or flexion. What type it is? It is because of extension. Because of extension, you have a Colles fracture. Colles has E and extension has E. It is an extension type of Colles fracture. If it has a flexion, you go for a Smith fracture. Okay. This comes to our end of the lecture. So thank you, doctors. Please like and share, and please do subscribe to my channel, because it gives me motivation for doing more lectures on these fracture classifications. And also I am planning for dislocation series, where I discuss all the dislocation classifications of all the joints, and also I am planning for cold classification series. Please do subscribe to my channel.